Fat transfer is a procedure that we perform both by itself and in combination with many of the other facial rejuvenation procedures that we do. It's frequently can complement or put the icing on the cake after we've done a brow lift, a mid-face lift, or a facelift. The areas that we commonly use fat to increase the volume of are the lips. We can use fat to fill in these creases here called the nasolabial folds. Sometimes a patient's submental crease here is too deep for their liking, and we can make it a little bit less sharp and strongly defined using fat. Fat is also a powerful technique that we can use to increase the fullness and softness of the malar area or the cheeks. With age as well, the area of the temples can become hollowed out, and that can be one of the stigmata of aging that can be addressed in a relatively straightforward, simple way by transferring fat to this area. Then too, on profile, some patients don't like the shape of their forehead. It doesn't have that gentle curve that they like to see. And rather than reshaping the frontal bone in the skull, we can just use fat to camouflage this and achieve the natural curve that they seek. So part of the beauty of fat, of using fat for fat transfer in this way, is the versatility of it, and it allows us to address so many areas of the face and shape it in a very malleable, plastic way. The fat that is transferred and reestablishes a blood supply is permanent. It also gives us the ability to increase the volume of these areas incrementally, so we can do it with a great deal of precision and care, sometimes in a single stage, but often in multiple stages to get things just right. And the fat transfer patients that we have in our practice are often some of our happiest patients. The changes that we can achieve can be subtle or very dramatic depending on what's called for, but I think patients are very happy that these changes are achieved using their own tissues.